Hey guys, welcome back to my channel. For those of you who don't know me, my name is Sarah, and I've been a family nurse practitioner for going on 5 years now. So I was recently involved in a nurse practitioner Q&A session, and they actually asked some really good questions. So I wanted to answer the same questions for you guys today, and hopefully you guys can gain some insight from some of my answers. And if you had questions about becoming a nurse practitioner, practicing as a nurse practitioner, hopefully I can answer some of those questions for you today. So let's get started with question number 1. What kind of nursing did you do before becoming a nurse practitioner? So my very first nursing position was actually a telemetry observation unit. I really had no dreams of any type of particular unit that I wanted to work on or any kind of specialty that I wanted to work. I just wanted to find a nursing job after nursing school. So the first job that I really saw online, the first posting that I saw, I literally just applied and went for the interview. I knew nothing about tele-obs. I heard that obs was going to be a fast-paced unit. So I stayed on my first unit for about a year. And that year was honestly, it was a year from hell. The manager was horrible. She was so mean. The staff, I made a couple good friends on that unit, but there were a lot of the nurses that believed in the whole eat your young thing. It was real. The medical assistants, they were bullies. So I honestly just hated that unit. And I would say after working there for about 6 months, I knew, oh, it's time for me to go. So I searched on the careers page on my hospital website and I saw a ICU position available. So the ICU to me was like the pinnacle of working in the hospital. So as a new nurse, the thought of me becoming an ICU nurse was just like surreal to me. I did not think I was going to get the position. I just wanted to interview for it and see what happened. And surprisingly, I got the job. I got the job. So my manager actually did make me wait. She held me back for a couple months actually before I was able to finally make that transfer over to the ICU position. And that's where I stayed for the rest of my bedside nursing career. So I worked as a medical ICU nurse, and that's my bedside nursing experience. I worked ICU for the vast majority of my career, and straight from the medical ICU, that's when I transferred over to my nurse practitioner position. Do you work alone? I do. So I currently work in an urgent care and I'm the only provider in the office. So I work by myself. I have a medical assistant who works with me, and she's the one that does the testing, checks vitals, triages the patient essentially. And then there usually is someone at the front desk checking patients in, and sometimes the medical assistant does both. But aside from the MA and me, that's it. I work by myself. And to be honest, for all of my nurse practitioner positions that I've held thus far, that's pretty much been the case. With the exception of my hospital job, I did work with one other provider. It was me and another NP or PA, and we sat in the office and worked. Did you receive any training? So for my urgent care position, no, I did not. I received 1 day of computer training just to familiarize myself with the charting system that we use at the urgent care. But aside from that, nope, not really. There was no training involved. And I'll be honest, it freaked me out. I was very nervous, but the medical director she told me, she said, look, if you have questions about anything, just reach out to me. Shoot me a text message, call me, and I'll be available for you if you need anything. And she has been. It was very nerve-wracking in the beginning. I was so scared, but it's been been a pretty good experience. So what I will say is in my other nurse practitioner positions, I did get training. So when I worked physical medicine and rehab, I did, y'all, I have my 1-year-old baby down here with me. He's next to me right now, kind of running around playing with balls. So if you hear anything, it's my kid, okay? For my first nurse practitioner position, I received about a month's worth of training where I worked one-on-one with another nurse practitioner. For the first couple of weeks, I shadowed her. And then from that point on, she shadowed me just to be sure that I knew what I was doing and I felt comfortable taking care of patients. And I would say a month was a good amount of time to be trained. For my next position in the hospital, I trained for about 3 weeks with a provider. Based on my experience, no training is not the norm. There typically is training involved. Urgent care is just a different beast. Who would you reach out to if you have a question about something? Okay, so it's hard for me because I don't have any other nurse practitioner friends or people that I graduated school from that I know of that work in an urgent care. So I don't have that person that I could shoot like ideas off of. I've got my urgent care guide, I've got my antibiotic guide, and I have a procedures book. I still have my resources, and I reference them all the time. So it's constant learning. I'm constantly learning, constantly getting better, and it's a journey. Can you work again as a bedside nurse after becoming a nurse practitioner? So the answer to that is yes, you can. So I actually did it a few times. The first time was when I first got my first nurse practitioner position. I actually still kept my bedside nursing job in the ICU, and I did both, actually in the same hospital. And the agreement that I made was that when I worked as a registered nurse at the bedside, I wouldn't practice outside my scope. So I wouldn't be making any treatment decisions. I wouldn't be placing orders, obviously, unless I got a verbal order from a doctor. But I just had to make that agreement to pretty much stay in my lane. And I did. And it worked out for a while until I decided I just wanted to fully immerse myself in the nurse practitioner role rather than going back and forth. What has been your experience working with a supervising physician? So overall, I would say I've really had good experiences, aside from the first one. That one wasn't great. I'm thinking that was probably more so due to his personality. So for my first nurse practitioner position, I worked with a doctor who, honestly, he was just a disagreeable type person. He actually made me cry once. He didn't see me. I got up and I excused myself and went to the bathroom, but I literally shed real tears because he was just very condescending to me, very rude, and just pretty much treated me like I was his scribe. But I will say that after I had a conversation with him and I told him, look, this is how you're making me feel, and I don't appreciate it. He did change. He wasn't as harsh. I could tell that he would think before he spoke to me, which before he really wasn't doing. But aside from him, I've actually had really great experiences. They've always been available to answer any questions that I might have. I would say initially I was intimidated just because I was coming from the mindset where what if the questions that I'm asking are stupid questions and they're looking at me thinking, this idiot. But then I had to realize doctors have questions as well. Doctors look things up on UpToDate as well. We are all in this together. I don't have to feel ashamed of asking questions and ashamed of things that I just don't know and I need help on, because everybody needs help sometimes. It's not really a us versus them type of thing in my mind. And I really haven't been treated that way at all. So I would say overall, I've had really great experiences aside from that first time. How did you prepare for your urgent care job? YouTube University. Okay. I spent so much time watching YouTube videos on urgent care. I purchased books and I read my butt off. When I tell you I was so nervous to work in an urgent care, I am not exaggerating. It had always kind of been a dream of mine, to be honest. I've always admired the providers who can just sit there and see patients that come in with the most random complaints and they'll know what to do. I always admired those people, and I'm one of them now. It's just what? I did see a course online. I think it was $1,000, and it was an urgent care course. And I really was considering taking it, but I'll be honest with you guys, I really didn't want to spend $1,000 on it. It looked really good, and I found some of the clips on YouTube, so I watched the free clips, and it's carried me through. My job has those practice suturing kits, so I practiced on those until I finally got my first patient, and I was scared, you guys. My hands were shaking. I think my first patient who came in with a laceration was a small child, so the parent was in the room staring at me. The kid is irate. The parent's trying to calm them down, and the parent's staring at me. My hands are shaking. It was just oh God. But I can say that those first few times, really the first few times that you do anything, you're gonna feel those nerves, and those are just growing pains. This just comes with new territory. So I hate that feeling of being the new person and being nervous and scared, but ultimately those feelings will pass. What chief complaints do you dislike the most? I really dislike ortho complaints. I would say my next least favorite would be fatigue, abdominal pain, and chest pain. Those would be the chief complaints that I dislike the most, just because the workup is extensive. The possibilities, there's like a plethora of them. So those ones are my least favorite. When those patients walk into the door, I'm not excited, but they come in all the time. Those are the ones that I dislike. What made you decide to become a nurse practitioner? I would say I officially made the decision after working as a bedside nurse for a few years, for a couple of reasons. The first reason I would say is because I just wanted to expand my knowledge. I wanted more responsibility. I wanted to be making the treatment decisions. I just wanted a change, and I wanted to learn more. I knew that I needed more education, and I wanted to go back to school. The second reason why I decided to become a nurse practitioner was because I was tired. So I worked in the ICU, so the patients were pretty much total care, and there was like one nursing assistant for the entire unit. So sometimes two, but towards the end for me, there was just one. So I'm giving CHG baths. I'm taking patients down to CAT scan multiple times in one shift. And when I say the patient, I mean the bed, all the pumps. It was just a whole ordeal. And then aside from that, you're dealing with all these personalities day in and day out, emotional breakdowns from nurses, drama. I was just over it. I was over the environment. I was over the fatigue that I was feeling after working 12-hour shifts. I just wanted a change of pace and a different lifestyle. So I went back to school. Those were some of the factors in my decision making to go back to school to become a nurse practitioner. How many patients do you see daily? So on your average day, I would say I see between 17 and 30 patients. It all depends on the weather. People don't like to come out in the rain. People don't like to come out when there's something weird going on with the weather. But I would say on average, between 17 and 30 patients. I've heard of some urgent cares, some of the providers seeing like 60 patients in a day, 60 plus. I don't think I'm willing to work in urgent care that's that busy, to be honest with you guys. I truly, truly, truly admire the providers who work in urgent cares where they see that many patients in a shift. I think my head would explode. I really think my head would explode. I honestly just don't think I could do it. So kudos to you guys, but I'm happy at the pace that I'm going at right now. It's totally manageable for me. All right, you guys, so that concludes my Q&A session for today. If you guys have any more questions for me, just leave them down in the comments and I'll be sure to answer them. And I will see you guys in my next video. Bye.